A tummy tuck, or abdominoplasty, is one of the most common cosmetic surgery procedures performed. Often, factors such as multiple pregnancies and genetics can contribute to the development of loose skin, fat deposits, and stretch marks in the abdominal region. Even substantial weight loss can contribute to the development of loose skin in the abdomen. As these areas typically persist despite proper diet and exercise, they can make the abdomen appear disproportionate with the rest of the body. A partial tummy tuck works by removing loose skin, fat deposits, and stretch marks from the lower abdominal region below the navel. In addition, vertical abdominal muscles that have stretched and weakened over time are tightened, restoring the appearance of a firmer, flatter abdomen. Tummy tuck procedures can be performed alone, but are often performed with liposuction to further improve body contours. A tummy tuck should not be considered as a treatment for obesity or a substitute for proper diet and exercise. Individuals considering a tummy tuck procedure should be healthy and relatively fit. Future pregnancies and substantial changes in body weight following a tummy tuck procedure, as well as the presence of scars from prior surgical procedures, may decrease the effectiveness and longevity of treatment. Unlike a full tummy tuck, a partial tummy tuck procedure typically only requires a single incision. This is because during a partial tummy tuck procedure, the position of the navel is unaffected. Therefore, an incision around the navel is not required. The surgeon will make an incision just above the pubic area. Although the incision is usually shorter than the incision made during a full tummy tuck, its length and shape will depend on the extent of treatment as well as the contours of your body. While the surgeon will attempt to place the incision so that it is hidden by a bathing suit or undergarments, it is important to realize that you will have a permanent scar. The skin and fat layers that lie above the abdominal wall are separated from the wall using a cautery device. The tissue is then lifted upward toward the navel to expose the abdominal muscles of the lower abdomen. In order to tighten the abdomen, the surgeon will suture the abdominal muscles, pulling them closer together, which creates a flatter, firmer abdominal wall and a slimmer waistline. Depending on the surgeon's preference, the sutures may be placed vertically down the abdominal midline or horizontally across the abdomen. The surgeon will stretch the layer of skin and fat that had been lifted away back tightly over the abdominal wall. The skin and fat that hangs beyond the original incision line is removed. In order to prevent fluid buildup as you heal, drainage tubes will likely be placed in the abdomen and will remain in place for approximately 2 to 3 weeks. The incisions will be sutured and dressings and bandages will be applied. You will most likely have to wear a type of compression garment, which is similar to a girdle. This tight-fitting garment will help to reduce swelling by preventing fluid buildup, as well as provide comfort and support as you heal. Depending on the extent of surgery, you may have to wear the compression garment up to several weeks. As with any major surgical procedure, you will likely experience pain, bruising, and swelling, most of which will subside in a few weeks. While you may not be able to stand fully upright, it is important that you begin to walk for short periods soon after your procedure to facilitate blood flow. Your stitches may dissolve with time. However, non-dissolving stitches will be removed in approximately 1 week, whereas sutures may remain in place for up to 2 weeks. Most patients are able to return to work in 1 to 3 weeks' time. However, it may take 6 to 8 weeks before you feel able to return to full normal activity, including heavy lifting and strenuous exercise. Although you will have a permanent scar, it will slowly fade over time. It is important to realize that if you become pregnant or experience substantial weight gain or loss, the results from your procedure may be compromised. However, with proper diet and exercise, the results from a tummy tuck can be maintained for several years.